So we are into episode 2, which, as previously mentioned, is all about when pain returns and when the pattern hasn't changed. So if you've ever had a treatment that worked, but only for a few days or a few weeks, and you felt better and things have eased off, and then gradually, not ironically, the pain comes back. I mean, that experience is incredibly common. I see it in massage therapy all the time. And to be honest, it usually happens for one simple reason. The pattern behind the pain never changed. See, most people, and honestly, most treatments focus on the pain area. Where does it hurt? Let's treat that. Massage it, stretch it, release it. All standards, right? And don't get me wrong, 8 out of 10 times, 9 out of 10 times, that can absolutely help, certainly in the short term anyway. But here's the problem. If the reason that area became overloaded in the first place hasn't changed, the relief doesn't last, because the system is still under the same stress. So the body does what it's designed to do. It sends the signal again. And there's a big difference between relief and resolution. Relief is when symptoms decrease. Resolution is when the system no longer needs to create the symptom. And those are not the same thing, right? You can feel better without actually fixing what caused the issue. And that's why so many people get stuck in this cycle, right? It goes like pain, treatment, relief, return, repeat. Not because the treatment failed, because the pattern stayed the same, right? I've said this numerous times before. The body is incredibly intelligent. It will always find a way to keep you moving, even if it's not the most efficient way. If a stabiliser muscle weakens, another muscle steps in. If a joint becomes stiff, another joint moves in. If posture shifts over time, certain muscles become dominant while others potentially switch off, right? At first, these changes are subtle, but the truth is, over time, they stack and they form a pattern that places repeated stress on specific tissues. And of course, and eventually, the nervous system steps in. We go back through the fact that pain is not just damage. Pain is a signal. It's the nervous system saying, this area is under more stress than it can currently handle. So it's protective. It's informative. Most importantly, it's responsive to change. But if nothing changes, the signal stays relevant, Let's make this practical. Take an example, lower back pain. A lot of the time, the lower back isn't the real issue. It could be a number of factors, right? Tight hips, weak glutes, reduced spinal mobility. And like a lot of us, sitting for long periods of time, that shortens everything up, especially on a fascial level. And the back ends up doing more work than it should. And it gets overloaded. You treat the back, it feels better. But the pattern hasn't changed. So the load returns. So does the pain, right? If we were to take neck pain, same idea, often linked to shoulder instability, thoracic stiffness, forward head posture, going back to the desks. The neck muscles are constantly working to stabilise the head all day, every day. So eventually, they complain. And again, the pain is a messenger, not the root cause, yeah? If the pattern doesn't change, the load doesn't change. If the load doesn't change, the stress doesn't change. And if the stress doesn't change, the signal returns. It's that simple. Pain returns when the system hasn't changed. Yeah. So real progress begins when we stop chasing the symptom and start understanding the system. Look at movement, stability, mobility, load distribution. Because when those things change, the nervous system often stops needing to send the signal. So I'll leave this with you, right? Pain coming back doesn't mean your body is failing. It usually means your body is repeating the same pattern. And it's asking for something different. In the next video, I'll be showing you how the body actually resolves pain when those patterns change. Because when balance returns to the system, pain usually stops needing to speak. Be well, be safe.